Worrisome news about sexually transmitted disease tonight on Call. Funding for On Call television is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
LARSON Manufacturing is proud to support On Call television as it continues to open doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by DakotaCare, the Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, Dakota Dermatology, Aberdeen Asthma and Allergy, the Orthopedic Institute, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation. The Center for Disease Control estimates that nearly 20 million new sexually transmitted infections occur every year in this country, half among young people ages 15 to 24. South Dakota is experiencing more gonorrhea cases than we've had since the 1970s. Worrisome news when the doctors are on call tonight.
Hello and welcome to On Call Television. Tonight our topic is all about sexually transmitted infections, or STIs, formerly called venereal disease, or VD, and then sexually transmitted diseases, or STDs. The CDC has now settled with STI, at least for a while. The South Dakota Department of Health asked us to bring this show to you because there is a rapidly spreading outbreak of syphilis happening in North and South Dakota right now, and it's starting to affect babies. But infections and infestations resulting from sexual activity includes many more dangerous organisms than just syphilis. We're also talking herpes simplex, genital warts, chlamydia, gonorrhea, trichomoniasis, body lice, HIV, and more. Populations at risk include not only young people, with increasing concentrations of baby boomers in expanding retirement communities, some who have lost their spouse, and with Viagra-like meds available, there is a new group with higher incidence of STI. Indeed, the information we share tonight is meant for people of all ages. I should say that this evening we're going to show some scary or uncomfortable pictures of infections on genitalia. These pictures are meant to inform, perhaps to motivate, but absolutely not to offend. Also, there will be talk of condom use for the purpose of preventing infection. This is not to condone or encourage sexual activity outside of a monogamous relationship, but only to explore options in trying to reduce this terrible infection in a human population. In fact, the major message one should take from tonight's information will be powerful encouragement to abstain from sex until one finds that special person, and then, before tying a knot, to both be checked by a healthcare provider for any sign of infection. To help guide us through this challenging field of sexually transmitted infections is Avera infectious disease specialist Dr. Brian Pepito, MD, here with me in the studio, and Dr. Lon Kightlinger, South Dakota State Epidemiologist, here by Skype from Pierre. Thank you both for joining us.
Good evening.
So let's start with you, Brian. You're from where?
Originally from the Philippines.
Okay, and you went to med school there?
Yes, I did my training here in Kansas City from 2007 up to 2013.
So you did your internal medicine residency?
Yes.
And then and actually you did a geriatrics specialty, and then you did your infectious disease training. Mm-hmm. See, I'm a geriatrician person too. I passed my boards many years ago. I haven't taken them again.
Okay.
But geriatrics is a point of my heart. So, and then you moved to Sioux Falls?
Yes.
How long have you been here?
August 2013.
So you've been here just about a full year.
Almost, yes.
And has it been a good experience?
Oh, yes, pretty good.
South Dakota, a lot like the Philippines?
Not
at all. Not at all.
No.
Okay. And Lon, tell us a little bit about you. Where are you from originally?
Well, Dr. Holm, hi. I'm Lon Kightlinger. I'm the state epidemiologist with the South Dakota Department of Health in Pierre, and that's where I am now. I was unable to get to Brookings to be on the show, so you had me Skype in here. So I hope this works well, and we get hooked up, and we'll see how this goes here. But I'm a South Dakota original native. I grew up in Selby, South Dakota, up in the north central part of the state. I went to college in Sioux Falls at Augustana for my undergraduate degree, and then down to New Orleans, Tulane University for my master in public health degree, and then the University of North Carolina in Chapel Hill for my PhD in parasites and infectious diseases. I've also worked abroad 20 years in the African country of Madagascar, where I must say, even though I'm not a STD specialist by any means, I saw a lot of STDs there, and it's truly very sad, especially for the most innocent of victims of syphilis, which would be babies born with congenital syphilis, and it's absolutely devastating. So I'm coming to you from Pierre.
Well, we really appreciate you being with us, and you know, it was you who brought us to do this. We were just about done for our season, and we were going to do the summer's best shows part starting tonight, and you said, but there's an epidemic, well, almost an epidemic now going on. What's the difference between an epidemic and what we're having with syphilis right now? You have to have a certain number or something like that. Brian, you know the answer to that?
No, I don't.
Lon does. What's the answer to that? This is not an epidemic yet, right?
Well, epidemic is a lot of cases over a very wide area. So that's a word of last resort. You know, pandemic, epidemic, those are really highly charged words. Even the word outbreak is really a loaded word. Sometimes I just prefer to say we have an increase in cases, or we have a cluster of cases. You know, we want to inform people, but we don't want to use, you know, too highly charged words. Even outbreak, you know, they made a movie a couple years ago, and its title was Outbreak. And that was meant to scare people. We don't want to scare people. We want to inform people and let them know what's going on.
Well, don't be bashful out there. Call in your questions about STIs or STDs or VD or whatever you want to call it at 1-888-376-6225, or email us at our new email address, ask@oncalltv.org. ask@oncalltv.org, no spaces. So we need your questions. This is a tougher topic. Any thoughts about this, we'd appreciate it. Any comments, we'd appreciate it. This is your show. Please give us a call or send in your message on the internet. Lon, what was exactly the thing that brought you to ask us to do this? It's the syphilis outbreak, isn't it? Tell us a little bit more about that.
Well, Rick, you know, we got a lot of things going on in the health department. It's not just STDs. You could do a show on obesity, on immunization rates. This week you could do one on pertussis, on tobacco use. You know, we just got a never-ending thing. But really, the STIs or STDs have been increasing in South Dakota over the past couple years. In South Dakota, we used to be a low incidence state. For many years, you know, we had one of the lowest rates of the STIs in the whole country. But in the past few years, our cases have doubled, and now we're unfortunately probably a high incidence state. And syphilis has been reintroduced into the state as a public health program. And I know these diseases, they're difficult to track. They're difficult to confront. They're complex public health problems with no easy solution. Most people just prefer to avert their gaze or even cast stones. But we have to face up to it, and that's what we're trying to do here. I'll go back to that slide on syphilis. Let me just talk about that for a second. Okay, here I have a graph here, and it's syphilis in South Dakota specifically. This is not national, but this is just in South Dakota. And we go back here about 30 years to 1984, up to the present. And you can see we went many years there back in the the 1990s and early 2000s, where we had very few cases, many years with just 0 or 1 case. Oh, I should have mentioned, across the horizontal axis, that's the years in time. And then the vertical axis, the bars, are the number of cases per year. So we were a low incidence state, and we had pretty well cleaned syphilis out. When we'd get a case, it would be some person from South Dakota would typically go to an urban center to our immediate east or to our west and get infected and come home. And then we were able to track the person down and interview them and find out who their sexual contacts were, get everybody treated, and just snuff it out and just draw a ring around it and get away with it. But now syphilis is back.
Yeah. It's
back in South Dakota. It's been imported, and now it's a homegrown situation that we got here in this state.
Now, there's some who say that it's related to the HIV that makes you more susceptible, and that those are always a big city scenario, and so on and so forth. Let's talk about that. Brian, tell us a little bit about, it's not men who have sex with men. MSM is what they say, men with sex with men. This is with man and women relationships in this scenario, correct?
Correct. Over the past couple of years, I think, in South Dakota, we have more cases of syphilis outbreak in heterosexual couples.
Right.
Previously, it was more people who are MSMs, particularly those who contract HIV, who have it. Right. But right now, from the cases that we've seen, it's more the heterosexual couples.
So how does syphilis present? I mean, acute. There's different stages. Let's talk about that first stage. When it first happens, what symptoms does it?
Okay, so the primary stage of syphilis is classically called the chancre, and you develop a skin lesion, which is characteristically not painful, so it's actually painless. And the problem with this is that it takes about 30 days to develop, and once you develop it, it may last a couple of weeks before it goes away spontaneously without treatment.
Right. We have a picture of that. It'd be nice to see that. Well, not nice to see it, but there it is. And it's the thing that makes it tricky is that it's painless.
Correct.
So when it doesn't hurt, well, I don't need to see the doctor. So that's enough of the picture, Lowell.
And that's the danger, I think.
There it is. It doesn't hurt. And so people ignore it.
Ignore it. And then it spontaneously goes away. So people think that it may have been something that we have just resolved on its own without any problems.
So what's the secondary syphilis picture?
So the secondary syphilis picture is that's the second stage. It may come on maybe months, about 6 weeks or so. And by this stage, the spirochetes, the bacteria that causes the syphilis, actually spread throughout the body. And this is where it becomes more symptomatic. People will actually go to their doctor to be checked. And the typical scenario are rashes, which initially begin in the trunk and the proximal limbs, and then spreads all over, classically appearing on your palms and soles.
Right,
the rash,
but it starts on the trunks.
Correct.
And they're a little nodular.
Syphilis is called the great mimic. It can actually present similar to all other infections. Typically, the classic one is nodular. It may also be a little rough. It may also be flat. So there's no characteristic rash of syphilis.
Okay, so that's the secondary syphilis. Now, here is the bad news, the third part of it, the tertiary syphilis, and it's now called something else, but what is that like?
Okay, so actually before you go into the tertiary stage, you actually develop the latent stage where everything quiets down again, and this lasts for several years. People are not aware that they have the infection until later on, several years later on down the road, where you get tertiary syphilis. And by this time, the bacteria actually settles into specific organ systems. So when it affects the brain and the spinal cord, you have neurosyphilis. It can affect your brain and spinal cord. It may also settle in the heart, causing problems with aortitis, or settle in your bone and cause a lot of damage in there.
So the classic is that you lose your vibratory sense, or you lose your sense in your feet. It's one cause for numbness in your feet. Now there's a lot of people out there who probably have numbness in their feet, and there's a million reasons. This is a distant one, but it can be one of the causes, and they'll stomp so that they can feel where their feet are.
Correct.
So we've got 30 seconds, final word about syphilis in the destruction of the brain. It does cause some dementia, right?
Correct, yeah. So it can cause dementia, it can cause some strokes, and depending on which nerves are affected, you can have specific symptoms.
Great. STIs come in many forms, and we're having varying success with each. Some that we thought were all but gone are back, and some treatments have improved to bring at least some control where there was none.
Syphilis is one of those diseases that in the year 2000 we had the lowest national rate of syphilis that we'd ever had. And that's coming down from around 600, 800,000 cases right at the end of World War II. Then we gradually brought it down with education and treatment. Between 2000 and 2010 in this country, we have doubled the syphilis incidence. In South Dakota, you have a very, it's an epidemic when you think about it, because you have a low population base, and yet you went from having 2 cases of syphilis or less a year to 21 early cases in 2012. Early case of syphilis is within the first year of infection. 2013 you saw 49 early cases, and so far in 2014, in the first 2 months, you've seen 46. So there is also a concomitant rise in the number of HIV infections you've detected, and there's a big rise in chlamydia. So my message is to all healthcare providers, when you are testing for any sort of sexually transmitted disease, you need to be testing for all 4 biggies: HIV, RPR for syphilis, or your syphilis screening, chlamydia, and gonorrhea, because they're co-travelers. And if you have one, you're much more likely to have another. And we know if you're HIV infected and get exposed to syphilis, you're much more likely to pick it up than the non-HIV infected person. And if you are HIV infected and have syphilis, you're more likely to spread it because your syphilis titer is higher. You've got more spirochetes circling in your blood. There's a lot more travel. People travel. They travel to have sexual escapades. They go to big cities where there's more syphilis, places like Denver, Oklahoma City, Kansas City. We know that there's more there. The outbreak was originally primarily in men who have sex with men, even in South Dakota, but has now spread and is primarily in the heterosexual population. And when you deal with syphilis in the heterosexual population, you have to think about congenital syphilis, which is a horrible disease for a baby to have. And you've already had a case of congenital syphilis here with this epidemic, and you hadn't seen one in nearly 50 years. So the rules then change once you've seen that, because all pregnant women now in areas where there's a high syphilis rate, and South Dakota counts, according to the CDC, as a high syphilis rate, a woman should be tested when she finds she's pregnant. She should be tested again in the 3rd trimester, and she needs to be tested at delivery. There should be no baby that leaves the hospital without a known serostatus level of their syphilis, because you can really make a difference in a baby's life if you take care of mother's syphilis before the birth. And we don't want to start seeing a lot of congenital syphilis. HIV is still not gone. We don't talk as much about it because it's not got the pizzazz it used to, and it is treatable. It's a chronic condition now, but it's a long-term chronic condition, and it is still a public health hassle and hazard. A lot of people are saying, well, with the Affordable Care Act, now everybody should have insurance. Why do we need special programs for AIDS care? We need it because no other chronic disease is sexually spread, and HIV is still a sexually transmitted disease. We're seeing an increasingly young population that are infected, and unfortunately the young population doesn't take treatment as serious as they should. They end up with resistant organisms. We still have people dying of HIV and AIDS, and that shouldn't happen. We also are still not testing like we should. There's a lot of people in our country, over 200,000, who have HIV that don't know it. We've been advocating routine HIV testing in everybody 13, 15 to 64 for years, and yet it's not being done. So we still have many people who don't know they're HIV infected. You don't get appropriate treatment if you don't know you're infected, and you continue to spread it. If you're sexually active, you're sexually active, and it doesn't matter whether you're 65 or 72 or 42. You can still get sexually transmitted infections, and in fact, women who are postmenopausal, who are over 50, 55, and most of us have given up our estrogen because of the Women's Health Initiative that says it's dangerous to take estrogen, means your vaginal tract is thin, it's a little more atrophic. So if you come into contact with any of these things, gonorrhea, chlamydia, syphilis, HIV, you're more likely to pick it up than you were as a younger woman because the vaginal mucosa used to be thicker and more mucousy and protected you. So if you are a sexually active senior, and that's good, there's nothing wrong with sexual activity, but if you are a sexually active senior, you need to think about STIs. You can get them just as easily as a young one.
Donna is a special friend of South Dakota. She's from Kansas, and she's a medical leader there, and she cares for a lot of people with HIV and sexually transmitted infections. And she was up giving a lecture in Sioux Falls, and we took advantage and grabbed her, and thank you, Donna, for that. Please give us your calls, 1-888-376-6225, or email us at our new email address, ask@oncalltv.org. ask@oncalltv.org. Thank you for your calls. And we might just jump in there, but I did want to ask you, so how do you test for syphilis?
So it's a blood test. It starts with a blood test, a specific blood test called an RPR, and then once it is positive, you get a confirmatory test to determine whether it is truly syphilis.
Right. Now, if a person is pregnant in this state right now, they're recommending that we do this, right, 3 times during that pregnancy?
Correct. Because of this outbreak, what we recommend is during the first prenatal visit, test them. The second time that they're in their 3rd trimester, and at the time of delivery to check them.
So it's important to do that. I mean, no matter how nice the person is, no matter anything. Right now, this is a hotbed in South Dakota. So the question, we have one that said, is it because people are coming from other countries or other parts of the country, or is it the oil drilling in North Dakota, or why is this happening? Lon, do you have an answer for that?
Yeah, but it's not an easy answer. It's a complex answer, and there's some of that. People are coming in and people are going out and getting infected. But the point is, it's now spreading here. It's being transmitted from South Dakotan to South Dakotan. It's homegrown. It's a local disease outbreak. So you can't blame it on the outsiders. You can't blame it on the people in the big cities. This is a South Dakota problem, a whole problem.
So how do we treat it, Brian? Is it that easy to treat? Is it pretty easy to treat? Is it getting resistance? Is it how do we treat it?
Fortunately, syphilis is easily treated with penicillin. So there are no known reported cases of resistance to penicillin. The actual penicillin dose actually depends on which stage of syphilis you have.
Okay, we have a question from Brookings. I've heard of rectal strep in children. Rectal strep infections. Does this ever occur in adults, and could this be confused with STIs, and how is rectal strep transmitted? Do you know anything about that, Brett?
Wow, this is a difficult question.
Yeah.
So Streptococcus is a normal GI bacteria. It's in your gut. It all depends on what kind of Streptococcus they isolated. I'm not particularly sure that what they found in this particular kid is a sexually transmitted infection to begin with.
Probably not.
Yeah, probably not.
Right, but because strep is everywhere. I mean, staph and strep kind of run together, and you can get those infections anytime. It just needs to get a starter.
Yes.
Yeah, so don't know an answer there.
No.
Lon, you have an answer to that?
No, I'll leave that to the disease specialist.
Okay. We have a caller that's from Sioux Falls. Is there an increase in syphilis with an increase in immigrants? I asked that question. Can you catch syphilis or other ID like MERS from toilet seats? How about syphilis from toilet seats?
Okay, so the way that syphilis is transmitted is through direct contact. So particularly if you have those skin lesions that I mentioned, once you get direct contact with them, you can get them. So it's not entirely unfathomable to get them from toilet seat.
Right.
Yep.
I do think, though, it generally doesn't.
It will probably be very, very low.
Very low.
Yeah.
But MERS, can you get MERS from toilet seats?
No, probably not.
Well,
no.
what is MERS?
It's the Middle Eastern Respiratory Syndrome virus that was recently discovered in the United States.
Right.
And it's a purely respiratory illness.
Okay, and have we been seeing it around here?
Not in South Dakota, no.
Where have we seen it?
So the first one was in Indiana, I believe, and then the second one was in Florida.
And it's virus?
Correct.
And it kills 40% or something like that?
That may be correct.
Yeah. So the other question is, what other things could be spread on the toilet seats? Chlamydia, gonorrhea, herpes simplex, other STIs.
So for infections like this, you need to have prolonged contact and repeated contact with the actual source. And so that makes transmission of sexually transmitted infections from toilet seats very, very uncommon.
Okay, so let's talk a bit. Well, let's take our question. Sioux Falls, is there a correlation between the advertisements for ED drugs and the increase in STIs? There we go. Lon, I'm going to ask you that one. What do you think about advertisements for or ED drugs?
That's hard. I don't have the data. And being an epidemiologist, I like to have data that shows that. Maybe we can do some type of a temporal association, because those types of advertisements have certainly increased over the past half dozen years, and our STDs have also increased during the past half dozen years. But that could just be a spurious correlation. It might not be cause and effect. So I'm not going to make any relationship there, but I know people think that. I just really haven't seen the data on it.
All right, so let's talk about prevention of syphilis, but let's talk about prevention of herpes simplex, which is it's a cold sore in the genital area, or gonorrhea, or chlamydia, or papillomavirus, or trichomonas infection, or HIV. What are ways that we can do to prevent those infections?
Avoidance is best. So sexual abstinence, when you could, proper choice of sexual partners, monogamy, and use of safe sex, condoms.
Okay. Now, but condoms, how safe are they?
They minimize the transmission of infections. It varies from one infection to another, but it's not a foolproof protection.
Right. And if, for example, genital warts, for example, commonly are outside the penis, and it doesn't work very well for that.
Correct.
But
yes.
it does for others. Mm-hmm. Is there a correlation? How do STIs affect penile adhesions? Okay, so penile adhesions are when there is inflammatory process going on within the urethra, and then it blocks the urine flow. What's your answer to that?
So it sounds to me like you're describing a case of probable urethritis, a condition caused by a lot of sexually transmitted infections. There are several infections that may present this way, and you will need to be tested for a specific infection so that you can get the proper treatment.
Okay, so come on in and get tested. So there you have it. All right, we have a question from Millbank. What symptoms would an infant demonstrate with congenital syphilis? Let's talk about congenital syphilis.
So congenital syphilis, unfortunately, during the first few weeks of exposure, infants may not have any symptoms at all. The number one symptom that they may have are snuffles or a runny nose. That's pretty much it. And then later on, as the infection settles in, then you will see more changes. So they can have the same rash that adults may have. And eventually, because children are young in their formative years, that actually leads to certain characteristic findings, like their teeth will have a specific appearance, their palates may be very, very high, their bones may become very brittle, they may have a facial deformity. So frontal bossing is what they describe it. And you can have a saddle nose deformity.
Right. How about their brains?
Their brains eventually may be affected, especially once you go into the tertiary stages, once the infection settles in, and you may have poor development.
Okay. Lon, you were in Madagascar for 20 years. What was your experience there?
Well, pretty much as Dr. Bryan described there, but we'd see it manifest in the worst way. There would be developmental delays, there would be mental delays, and the poor kids just never had a chance. You know, you're dealt that, and then you're dealt with all the other insults of living in an underdeveloped country: diarrhea, malaria, malnutrition. It's just very bad.
So, and the classic forehead is bossed, is prominent, saddle nose, so that the nose is kind of caved in, and they have a characteristic with its teeth that are different too.
Yes.
So it's not a good thing, and we've seen one case so far in South Dakota. Not that many cases, if you look at the total number, although certainly an increase. Here's a question about Gardasil. One of the sexually transmitted infections is genital warts, and it's probably the most common infection, the most common STI. Something like 30%, 25% of all people in the U.S. have this. And the question is, what can you do to prevent genital warts?
So their genital warts are caused by a virus, the human papilloma virus, or HPV.
Now, it's the same as a wart that grows on your hand or anywhere else. So
yes.
It's a wart.
Correct.
It's just a plain wart, but it's down there.
Yes. There are more than 30 serotypes, and some are benign. Some are associated with cervical cancer. So the more malignant types are actually studied, and the vaccine called Gardasil has been developed specifically for this. It targets 4 different serotypes, and it helps prevent the acquisition of these particular serotypes of HPV, thereby preventing cancer.
So all cervical cancer is related to warts?
Correct. HPV.
So without warts, there would be no cervical cancer? Or almost.
Almost, yes.
And so what? Taking this wart vaccine, it prevents the kind that causes, not all of the warts that occur down there are the kind that can cause cancer.
Cancer, yes.
One particular, but 2 or 3 others can also do it.
Yes. So there are 2 types, 16 and 18, which are associated with cervical cancer, and then 11 and 14, I believe, which are associated with a pre-malignant cause. Okay. For cervical cancer.
So there is actually a vaccine that will prevent cervical cancer. I mean,
correct.
So, but why isn't it happening? Why isn't Gardasil occurring? I mean, they're suggesting it for what age?
Age 13 to 26, both boys and girls.
Right, and it's expensive.
It actually is dependent on your insurance provider.
Right.
So,
and since 25% of the population has this, Why wouldn't you have your child get this vaccination?
I think there is a stigma that if you provide a vaccine to a kid, you're actually falsely promoting
sexual activity.
Yes.
All right. It's not just syphilis and HIV on the rise. The rate of all STIs is increasing across the United States.
Our incoming freshmen, I always advocate abstinence. I always think that is the best option, not only for pregnancy, but also for STIs, STDs. We do offer free condoms here in the Wellness Center. That is something we encourage all of our students to utilize if they are having intercourse. We definitely don't want our students to be having unprotected intercourse, so we try and do our best to educate them, and those are available all year round. STDs are definitely on the rise right now in South Dakota and across the country as well. We see here on campus, we do see a lot of chlamydia amongst our students, so we try and do a lot of education to help our students not get those diseases. Definitely, if you notice any signs or symptoms of any sort of STI or STD, you should definitely come in and be checked either by a nurse or your regular provider. It's definitely not something you want to just let go. Oftentimes with chlamydia, patients don't have any signs or symptoms, so it's very important to be screened on a regular basis, especially if you're having unprotected intercourse. Other symptoms might be like discharge from the genitals. You might have urinary tract infection type symptoms, so burning with urination, frequency with urination, or urgency. So those are some other key things that you would want to pick up on. Syphilis, oftentimes patients will see a painless ulcerous sore on their genitals. Otherwise, it can also be in the mouth. It can be also in the rectum. Otherwise, patients might also see a rash that is most commonly seen on the palms of their hands and the soles of their feet. But it can be also in other parts of the body as well. If our patients come in and are concerned that they have an STD, kind of depends on their symptoms what we're going to do for them. If they're having burning with urination, frequency, urgency, maybe some discharge from the genitals, we like to do a urine sample, and that will test for chlamydia and gonorrhea both. If they're concerned about herpes and they're having these open sores, or syphilis and the open sores, or the rash, that would be a blood test that we would do. HIV is also a blood test. Viruses would include herpes, hepatitis, HIV or AIDS. Otherwise, the bacteria that we can treat and cure for people would be chlamydia, gonorrhea, syphilis, trichomoniasis, or trich. Trich is actually a parasite that can infect the genitals. Oftentimes, it might not have symptoms again, or you might have a lot of discharge or those UTI symptoms. When I'm going through education with my patients, I always go through all of our STDs on one of our pamphlets and explain signs or symptoms and how to protect themselves from getting those infections. I also encourage abstinence from getting any of those STIs, and also I encourage condom use. We encourage all our female patients to have an STD screening at their annual exam. That is their choice if they choose not to. However, we do recommend it if you have been having unprotected intercourse. And as far as for men, we say if you are having unprotected intercourse, at least come in once a year, but we really encourage at least 2 to 3 times a year to have those screenings done. And it is just a urine sample, so it's not anything painful.
Join our conversation. Call 1-888-376-6225 or email us on ask@oncalltv.org. O-R-G. So that's interesting. She talked about a variety of things, but gonorrhea is one of those things. I want to show the picture of the child that was born of someone who had gonorrhea. What's this, Brian?
So this is gonococcal conjunctivitis, typically contracted when a baby passes through a vaginal canal infected with gonorrhea.
And so this is one of the things that why they put those drops in those babies right away.
Yes.
All right, and so we're talking gonorrhea. We have a slide about gonorrhea that we should put up right now. This is gonorrhea in South Dakota, and it looks like, wow, it's on the climb. So that's good enough. Let's talk to Brian about it. Brian, what about the treatment for gonorrhea? We have antibiotics that cures it, right?
Correct. The unfortunate thing about this, though, is gonorrhea has learned to adapt to the common antibiotics that we give. And so a lot of gonorrhea cases are actually resistant to what we used to give in the past. So constantly we are modifying and updating our treatment regimens for gonorrhea.
And it seems like it's then it gets a resistance to that and does the Texas sidestep or the South Dakota sidestep or whatever it might be, you know. And so resistance in gonorrhea is occurring. What about the others? Chlamydia, is it developing resistance?
Fairly sensitive still.
So we're still okay with chlamydia. How do you make the diagnosis of gonorrhea?
Gonorrhea is, both gonorrhea and chlamydia actually are simple tests. We take, for men, it's a urine test or a swab in the urethra. For women, it's a vaginal swab, and we send it for testing.
All right. Do the next slide, which is a slide about gonorrhea, one more time. That's the incidence of gonorrhea throughout the United States. Lon, any comments about those slides and what's your thought about gonorrhea in South Dakota?
Well, as I said, we used to be a low incidence state, and this shows gonorrhea rates by county, by U.S. county. There's over 3,000 counties in the country, and the darker the county, the higher the rate. And you can see dark spots across the state of South Dakota. We have higher rates of both gonorrhea and chlamydia than any of our neighboring states. So we are becoming a hot spot here.
Right, and so, my producer says, look at the southern states, and I point out that we're Southern Dakota, which is maybe the reason why it's there. That was a bad joke. I'm sorry, bad joke. But let's talk about chlamydia. Now, chlamydia is different than gonorrhea. It's a bacteria, but what is it like, Brian? I mean, is it a smaller
organism? It actually cannot be detected on culture. It lives in the inside of cells. It's very, very hard to see.
So how do you diagnose it?
So also a urine test or a swab in your urethra or a vaginal swab.
Okay, and we can recognize it pretty well. I mean,
our tests are really, really good.
And we have good treatment for that.
We do.
What symptoms would you have from, well, let's say gonorrhea and then chlamydia? What symptoms?
So gonorrhea is actually more symptomatic. You will tend to have a purulent discharge in your genital area, and you will tend to have some discomfort.
Purulent discharge meaning?
So pus, yes, pus, and you may have some, because it causes urethritis, you will have problems when you urinate. You will have some discomfort in there as well. So
men and women? Men
and women, yes. Chlamydia is different on the other hand because most cases are asymptomatic, particularly in men. If, for example, you do have symptoms, the most common symptom that you have is urethritis. Again, discomfort when you urinate.
Right, but many men have it, don't know they have it, and happily spread it to their partners.
Unfortunately, that's true.
We have a slide about chlamydia coming up here. Let's take a look at that one, Lowell. And there it is, chlamydia in South Dakota, also on the rise. Any comments about that one, Lon?
Yeah, we used to be, again, a low incidence state. We had around 1,000 or so cases back in the 1990s, and we've been going up, 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 and up. We've nearly doubled just in the past 6 years or so. So this is a trend that we don't want to see. We want to see our disease rates go down, not up. And we're getting the opposite with chlamydia, with gonorrhea, with syphilis, and also to some extent with HIV. So we're going in the wrong direction.
We have another slide that we can look at the map of the United States, and the green color is where we're finding the chlamydia infections. That's of value. There's a lot of green in South Dakota, unfortunately, also down in the south, but certainly a lot in South Dakota. Any comments, Lon?
Well, yeah, you don't have to go to the big city to catch these diseases. We've got it right here in South Dakota. You have to be knowledgeable, you have to protect yourself, you have to be abstinent, you have to be monogamous, you need to be screened, because these are diseases we have here.
Any other comments about that, Brian?
Because these illnesses tend to be asymptomatic, we recommend yearly testing, at least yearly testing.
So if a woman has chlamydia or gonorrhea, and it goes for a period of time, or even if you treat it, sometimes they'll catch a pelvic infection, a pelvic inflammatory process. Let's talk about PID.
So pelvic inflammatory disease is a well-recognized phenomenon in women who have undiagnosed sexually transmitted diseases, particularly chlamydia and gonorrhea. So what happens is, because they tend to be asymptomatic during the early stages, the infection can continue to progress, and it may eventually develop into a severe infection where it damages your anatomy, and as such, it leads to problems with getting pregnant.
So they become sterile.
Yes.
So I read where the first time 25%, or first time you get that infection, 25% will be sterile. The second time it's 50, and the third time it's 75, or some number like that.
Yes, that is actually one of the tests that are performed when you're evaluating a woman who can't bear children. Check for sexually transmitted diseases.
Oh, you run the gamut.
Yes.
Check for all of these.
Mm-hmm.
There's one more slide that is a picture of the age differential in the sexually transmitted infections, and this shows that the age bracket in the 15 to the 24. Lon, would you?
Yeah, sir. What we have here is, again, age groups across the horizontal, the bottom axis, starting with young babies. You know, we don't have any in that age group, none in the 1 to 4-year-old age group, but then we start seeing it in young children, 5 to 14 years of age. We had last year, this is 2013 data, we had 56 cases reported in that age group, and that's, you know, very, very disturbing. And then it really skyrockets. And we have over 3,000 cases. Most of our cases in this state are in that group of young people, 15 to 24 years of age. And those are our high schoolers, our college age people, our people that are just starting out their lives, the early marrieds. They're having it. And then it goes down as we age, and we have a few people in the 65 plus age group. Again, very serious, and that's more a rare event, but I want to focus on the people in that young age group, because that's where most of the disease is in South Dakota and the United States. And if we look at it geographically in South Dakota, it's across. We had cases in all 66 of our South Dakota counties last year, all types of groups, all races. We had cases among the rich, among the poor, among the high and the mighty, among the homeless, among the Pharisees, among the accusers, East River, West River, male, female. You know, it's
everybody.
It's all over. Yeah, look, over 2/3 of our cases are female, but that I think has to do with we just have better screening protocols among women than we have in men. But this is a disease that doesn't choose, so you really have to be aware and protect yourself, because it might get you.
So the thought is that if we provided condoms, or if we provided the vaccination against human papillomavirus, or if we did our efforts to protect our children from these illnesses, will that encourage illicit sex? I mean, there has been that concern. I mean, it's a reasonable concern. And I'm going to ask you, Brian, your comment about that.
So certainly consideration, yes. I understand the concerns that parents may have with this issue. But if you look at the overall picture, preventing them from contracting the human papillomavirus will prevent them from getting cervical cancer, which is a very preventable disease, a serious disease that is easily prevented.
So that vaccine, I do not believe we have any data to suggest getting the vaccine will open up the say, okay, free love now, I mean, I'm safe. There are certainly many other reasons to protect yourself. The condom issue, of course, is a concern. Do you think that people think, well, they're safe if they use condoms? What's your comment about that?
That is the general perception, yes. Unfortunately, it does not prevent all sexually transmitted diseases.
Okay. Lon, any comments about encouraging sexual activity by using protection?
Well, it might a little bit, but our first line is abstinence and monogamy. And I just want to show you this chart here, Rick. This is just one of the clusters that we have in South Dakota, and the little dots are for cases and their contacts. And you can see it's like a spider web crawling across the page, where one person is with another person and that person is with 3 more person, and then you get 5 more people, and to get everybody there to use a condom or to behave themselves is very difficult. We have people who are drunk and on drugs. They don't know what they're doing. They go too far. They don't use protection. We have people that are they've got their cell phone, and there's some app on there, and they can do anonymous sex by some type of social meeting. They don't even know who they're with. We got people can't remember who they're with. We've got all these different things going on. So
I think your point about it affects the rich and the poor is very important. Good people, and actually this is not an issue where some of the nicest people are caught in these things. So, well, I'm going to make that comment, but we'll be back right after this.
What's up? This is Swiss Beats. Do you know that 1,000 people ages 13 to 24 are infected with HIV every month in the U.S.? As African Americans, HIV hits us harder than any other racial group. We account for over 44% of all new HIV infections in the U.S. You can't tell by looking at somebody if they're infected. Do you know your status? Visit Act Against AIDS to find out where you can get tested for free.
Get tested. Check your status. Get tested.
In the 1970s, we saw an era of free love, representing openness, sharing, and a lot of sexual activity with multiple partners. Just a sec. Let's roll it. So, but is all that sharing a good thing? Consider a few facts about sexually transmitted infections, or STIs. Fact: human papillomavirus, also called HPV or genital warts, is the most common STI, currently infectious in 79 million people in the U.S., or 25% of the population. HPV can cause cervical cancer. However, scientists have developed a vaccine that prevents and protects against HPV warts and therefore against cervical cancer. Fact: herpes simplex virus causes cold sores, a lip skin infection that permanently resides in about 70% of all people by the age of 50. A genital STI version infects at least 20% of all adults, with 90% being unaware of it. Fact: chlamydia is a bacterial STI that newly infects 3 million people per year, is silent up to 70% of the time, and yet 20 to 40% of untreated chlamydia infections in women cause painful pelvic inflammatory disease, or PID, which too commonly causes ectopic pregnancy or infertility. Fact: gonorrhea, another bacterial STI like chlamydia, can sometimes infect without symptoms, but can also cause PID and infertility. The big time problem, though, with gonorrhea is resistance to antibiotics. Fact: the protozoan trichomonas, another STI, often causes no symptoms, but can cause itching, bad body odor, painful intercourse, PID, infertility, and premature low birth weight babies. Fact: the incidence of pubic lice or crabs is 1 in 90 people in the U.S. Fact: more than 15% of all people infected with HIV, more than 15% in the U.S. do not know they are infected. Another HIV fact: 50% of all cases are not just involving men who have sex with men. Fact: South and North Dakota are having an ongoing syphilis outbreak, the worst in 50 years, with recent case of mother's infection causing infant disease and disability. The Department of Health is calling all healthcare providers to test for syphilis 3 times during all pregnancies. People with painless ulcer or on groin or mouth new bumpy rash, or patchy hair loss should seek treatment to avoid severe nerve or brain destruction from this STI. So it is, sharing of love can bring sharing of malicious infections. I guess free love is not so free after all.
In a God of freedom, honey, don't you know that I'm loving you? In a God of freedom, baby, don't you know that I'm...
This brings us to the end of our show this evening. I sincerely thank our good friends and guests, Dr. Brian Pepito and Lon Kightlinger, for helping answer our audience questions this evening. As often happens in the program, we weren't able to get to all of your great questions. Please join us now on our new website, oncalltv.org, to see answers to the questions we didn't get to. We'll be live on the web in just a few minutes. American icon Bill Cosby said it this way. Cosby, sex education may be a good idea in the schools, but don't believe the kids should be given homework. Until next time, stay healthy out there, people.
Funding for On-Call Television is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
LARSON Manufacturing is proud to support On-Call Television as it continues to open doors for important medical information.
and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by DakotaCare, Brookings Health System, Dakota Allergy and Asthma, Dakota Dermatology, Aberdeen Asthma and Allergy, the Orthopedic Institute, and Swiftel Communications. Closed captioning for On-Call is provided by the generous support of Avera, Brookings Health System, and Fishback Financial Corporation.